How to do a progress review. Welcome to the CBAS module on how to do a progress review. At the University of Alberta Family Medicine Residency Program, this is also known as the 4-month progress report. This module will bring you through a typical example of how a faculty advisor may conduct a periodic review. Faculty advisors do all progress reviews a little differently. I'm going to take you through my process for doing a review. I hope this will be helpful, especially if you haven't done a review before. When it's time for a progress review with my resident, I get an email notification that comes into my mailbox. I open the task by clicking on the link, which brings me to the CBAS electronic platform. On the website, I can find the task related to the periodic review in my to-do list. One of the first things I do when organizing the progress review is set up an appointment to meet with my resident. The face-to-face meeting usually takes me 30 to 60 minutes, depending on how well I know them and where they are in their training. Then, prior to the meeting, I review the available documents. This usually takes me 15 to 20 minutes. During this prep time, I review content of some of the field notes, review any 145 rotation evaluations, and open and review parts of the progress report. My clinic staff also prints a short report with useful measurement data, which includes an overview of the diagnostic codes that the resident has documented, the age spectrum of patients seen, and continuity data on how often my residents see their patients in follow-up. By the time I receive the progress report, the resident and site administrator have already filled a portion of the report. The progress report and face-to-face meeting is dedicated time to look over the last 4 months of the residence program, to organize and review the sampling of documented feedback that the resident has collected, and to decide with the resident a learning plan and some goals for the next 4 months. Reviewing all these pieces really gives me an overall picture of competence and helps us both to identify possible gaps and areas for further focus. This next part of the module focuses specifically on the content of the report. On the first page of the progress report, I scan the number of field notes across the clinical domains and sentinel habits to have an idea of where my resident has received feedback in the last 4 months. I take note of areas that have lots of field notes and other areas in which there's less evidence of feedback provided to the resident. I then open up the specific electronic portfolio within CBAS for this resident and remind myself of some of the field notes that I've written. I also scan to see if there's any field notes written by other preceptors. If you open up a separate browser window, you could have the dashboard and the report open at the same time. In the first year, there's often field notes written by facilitators in the doctor-patient relationship course or for primary care obstetrics, as well as other specialists that help to teach our residents. I then choose to sort my field notes, which is one of the green buttons available on the dashboard. Sorting field notes gives me a good sense of how many of the field notes have been tagged with stop important correction, carry on got it, or in progress overall. Sometimes I also sort the field notes to sentinel habit or clinical domain depending on what experiences my resident has had recently. For example, if they have completed a pediatrics experience or a palliative care rotation, I see if there's any documentation of feedback that has occurred in these specific clinical domains. In each 4-month period of time, I should expect that approximately 16 field notes have been completed, keeping in mind that most of the time when my resident is coming back for their continuity clinic or half-day back, I'm completing at least 1 field note for something that I've observed or that we've discussed. I then go back to the report and review comments added by my site administrator. I review the rotations completed since the last report, the list of specific program requirements and the dates that they were completed. I review absences and percentage of continuity clinics attended since the last report. Your resident should have attended 100% of clinics scheduled. Then I review the resident's guided self-assessment. I'm particularly interested to see if my resident feels continuity with and responsibility for a panel of patients within my practice. Sometimes continuity is more difficult in the PGY2 year, so we discuss ways to improve this, such as booking patients directly with the resident before patients leave the clinic. Residents also have a chance to document if they've had any issues with past ITERs or rotations, or if they've perceived any harassment or abusive behavior on any rotations. Residents also have space to reflect on future career plans. This is an area that I do spend some time on when we meet in person. The other activities that residents list give me an idea of their other interests and extracurricular activities that they are involved in. Residents have usually filled in their residents' comments section, which is really to capture their ideas of where they'd like to focus their learning in the next 4 months and what opportunities they'd like to pursue. The advisor's report is where you can expand on any plans that you have developed with the resident. This section is an open narrative box that you can use to explain resident progress, highlight areas from the progress report, document learning objectives, or to describe any difficulties the resident might be experiencing. Selecting the appropriate milestone is described in further detail in another module. Briefly, milestone 1 is selected if you feel the resident is ready to start seeing patients more independently, seeking your input and help as required. This typically happens for most residents sometime around the end of PGY1. Milestone number 2 is for the faculty advisor to signify when program completion is recommended. Typically, this happens at the final progress review at the end of PGY2. During the actual face-to-face meeting with the resident, I go through the parts of the progress report in detail, planning for upcoming educational experiences and reviewing competencies. We look at the spectrum and samples of the feedback documented in CBAS and decide where more field notes are required to maximize learning. The resident is aware of all the comments that I will document on the advisor's report, and I often fill out the comments with the resident in the room. As mentioned at the start of this module, every faculty advisor does their progress reviews a little differently. The main take-home points are: set up a face-to-face meeting, review a selection of field notes and other assessment documents prior to your meeting, review the resident's guided self-assessment, and develop learning plans together, complete the report, and forward it to the program. Thanks for listening.